Hello, and thanks for joining me tonight. My name is Mike Tellerino, your host for tonight's podcast. I have Ken Avery, our co-host, and I got Wendy Jaffe and Lenora Albee. Did I,
Yes,
did I get that right?
you did. Yes, you did.
Well, listen, it's an awesome having you here tonight as our guest. I've learned a lot about your organization, and the more I learned about it, the more I just thought this is something we have to get out to the public to let them know that there's this awesome organization out there doing all these great things in the home care industry because they're
Absolutely.
far and few between, especially the ones that really care
Yeah.
about their patients, not just are there to provide a service, collect a check,
Abs-
that actually care about what they're
Exactly.
doing. And
Absolutely.
that's what sets BrightStar apart from all the other organizations that I've looked into.
Mhm.
It's just amazing. So, Lena, why don't you start out by telling us a little bit about BrightStar, how it started, and what it consists of?
Absolutely, absolutely. Well, first and foremost, Bright Star Care, we are of Chicago and LaGrange, I would say. There are multiple Bright Star locations throughout the entire U.S. So we service Cook County. So that will be the city of Chicago and like the Oak Park, LaGrange area. So that's first and foremost. But I myself, I've been with the organization for about 10 years. And I've always worked in the operations department and became one of the owners here back in 2024. So, but again, to your point, this definitely is an industry that has grown, and that's definitely our goal was to continue to help more people throughout the Chicagoland area. By doing so, we provide medical and non-medical services to those in need in their home. We provide care for all ages. So we have had clients who are infants. My youngest clients over my 10-year here, the youngest client was about 4 months old. And today our oldest client that we've serviced, the most seasoned, I would say, is about 110 years old. So
Wow,
we cover everything in between.
that's amazing.
Absolutely. And multitude of different types of services, ranging again from our skilled services to our personal care services, where we have aides in the home that are helping with their everyday needs, activities of daily living, personal care services, even helping with errands. They can also escort our clients to and from appointments to the grocery store. So just helping with their daily activities. That's what we're here for. And let me tell you, this industry is growing. Is growing tremendously, and it has done so year over year. Why? Because more people want to remain at home. More people want to age at home,
Right.
which works for us because we're able to bring the care to them.
You know
Okay.
what amazes me is when I take our service dog, we go visit nursing homes and the VA hospital. When I walk in the nursing homes, they're all lined up in a wheelchair along the
Mm,
wall.
absolutely.
No emotion whatsoever. I
Mhm.
walk in with my service dog, and boy, they just perk up and they just say,
Yes,
I used to have a dog. They just, because they're actually getting some personal attention
absolutely.
rather than just existing
Mhm.
in that nursing home. Let me
Abs-
ask you, how hard is it to get home health care? If I have a mom who's 75, 80, or I don't want to say I'm almost 70 now. If I have an elderly parent
uh-huh.
and I'd like to get her some health care
Yeah,
in home because I don't want to put my mom in that therapeutic
absolutely.
nursing home, what's the
Mhm.
process for that?
Absolutely. Well, it depends also too whether or not the individual has insurance. Now, with BrightStar, I will say that we are a private pay agency. So the clients that we service pay us directly outside of some of the organizations that we work with that actually reimburse for services. But again, I would say to that individual, if they have insurance, definitely look within their provider to see if they can locate a provider that's covered within their insurance,
Right.
or they can most certainly converse, an agency or call such as ourselves, and we can provide that over the phone consultation to discuss our services and how we can help.
That's awesome. You know,
Right.
I don't know anybody who wouldn't want to have their loved one in a,
Mm-hmm.
at home,
Right.
Mm-hmm.
someone coming and actually caring about them than
Yeah,
being in that cold atmosphere
absolutely.
Mm-hmm.
of a nursing home. I mean, I visited my mom one time. She had surgery in the nursing home, and I didn't like even going in there.
Mm-hmm.
No.
It
Yeah.
just too
Yeah.
wasn't for me at all.
Yeah, and you can really see the difference when you bring someone out of the nursing home to their home.
Mhm.
They thrive. You
Mhm.
Right,
know, it's their own food, their environment.
right.
One gentleman was like, if I could just get to my recliner, I'll feel so much better.
Absolutely.
We got him there. He's like a king in his recliner.
That
Absolutely.
and that means the world as somebody who loves my mom or my dad and I want the best for them. It
Mm-hmm.
doesn't get better than that
Yeah.
Absolutely.
because you know they're getting that personalized attention that they just
Absolutely.
don't get
Right.
in a nursing
Absolutely.
home.
Absolutely.
Isn't
You get that one-on-one patient care,
Mhm.
in the home,
Yeah.
Yeah.
which again, you get the individualized,
Mhm.
personalized care right in
Mhm.
their home.
Right.
How do
Absolutely.
you how do you pick and choose your staff?
So, absolutely. So, essentially, what happens, and I know Wendy can touch on this, but every single client that we enroll, we do an in person assessment or evaluation just to determine what level of care is needed and the type of care we can provide. Based on that information, we're able to go to our roster, our team of caregivers, to identify someone who would be the best fit for that
Right.
individual. We guarantee compatibility. And all of this team members that we have experience, all right? That's one of our requirements for employment. But again, just because they have the experience, it may be a personality that may be different, right?
Mhm.
So we try to, after meeting with the individual, the client, the nurse does a great job, like Wendy, for example, just meeting with the client, understanding their needs,
Right.
what their preferences are. We take that information and try to identify a caregiver who would match or be a good fit based on what they're looking for.
Mhm. Yeah, and I will say our agency stands apart because it's called the living room visit. So we just don't get a call for services and then just send anybody out. We want to evaluate, like Lenora said, make sure that the needs are appropriate for whatever setting they're in, make sure that the environment is appropriate for sending somebody, our caregiver out there.
Right.
And so like Lenora said, and then we can develop and get a good fit so the client is happy and the caregiver is happy.
What about a patient that has Alzheimer's or because that's pretty prevalent
Mhm.
out there
Absolutely.
today, too prevalent.
Yeah.
That's my biggest fear, mind you.
Uh-huh.
Yeah.
But
Yeah.
of getting Alzheimer's. But do you work with Alzheimer patients or
Absolutely.
Mhm.
Well, one plug I would say, and one perk that we have is we have a dementia care specialist. Miss Wendy here. So she actually went through additional courses and certifications because during those meetings in the home, she is able to, again, include that in her meeting or evaluation with the family. And she can also provide recommendations and tips. But guess what? We have caregivers who have gone through the dementia care program that we have. We have a special program where we're able to help coach, teach, and train caregivers and provide that extra seal of approval and certification for them because they've gone through the dementia program that we have.
right?
But again, we have our dementia care specialist who is able to work hand in hand with our families to help everyone cope, right? Because there are different levels of different stages, but our nurse is very involved with the family and the client and the caregiver just to make sure that, we can provide the best care for the individual given the stage that they're in.
So you administer if they're on medicine at a certain time. You make sure they're taking their medicine or given their medicine.
So, in terms of caregivers, again, we do provide skilled services in which we will have nurses that can provide that level of care in the home. In terms of, we do have caregivers who can provide personal care services, but they cannot administer the medications in the home. If they need someone to administer, we can discuss skilled nursing services for them.
Okay.
Yeah, the caregiver can remind them, did you take your medicine, and remind them where it is, but they cannot actually hand it to them. Should they give the wrong medicine, it's a liability.
Be a lot of liability there.
Right.
If it's done inadvertently, nobody's going to do it intentionally, but inadvertently, nobody wants to be held responsible for that. So
Right.
I can, I
Are
completely
you
understand that.
are you a 24-hour service in the home, or hourly, or
Absolutely.
how does that work?
We provide care up to 24 hours a day, 7 days a week.
So they stay there with.
Yeah.
Oh, wow. Nice. Nice.
Absolutely. Yeah.
Yeah.
Absolutely.
And I just want to go back, Lenora can touch on this too, about our process for bringing in staff, because we are very rigorous in that process. And you can
absolutely.
address,
we have a very extensive screening process, as you brought up the example of a person with dementia. So again, we have a very extensive screening process. As I mentioned before, everyone that we hire has to have a minimum number of years of experience. We do through like a phone screening, a video screening, in-person screening, competency and orientation, training, different background, drug screening. So we have an extensive process just to make sure that they have the skill set that's needed to work with clients in their home.
How hard is it to find employees to be out there in the field doing that?
Sometimes it can be challenging. Just having dedicated staff, reliable staff, but again, we have recruiters who we work with us full time, and that's their goal, is to find those compassionate caregivers, find the great CNAs, the caregivers who can work with our clients. That is a full-time commitment. But again, that's a commitment that we're willing to take just to service our clients. But it is challenging to find good talent, but we have a ton of awesome caregivers on our team who have been with us 10, 12, 15 years. And I know more out there. So
can you share a story with us, a success story that you just find amazing?
Yeah, I mean, we have, go ahead, I'll let you share.
we have so many, it's hard to really pick one, but I'll just do one, that a veteran that we just got. And he was very, very nervous about somebody coming in his home. He's very private, he's used to doing his own, taking care of himself. He was a commander in the military, and he just barely talked to me. So we got him a caregiver, a lovely, one of our caregivers who's been with our agency for a while. And she said to him, do you mind, could I bring my dog? And they had just lost their dog. And he goes, yes, that would be good. He opened up. He's like a different person. He will not let our caregiver come without her dog. So he would rather have her dog than the caregiver.
How
I hate to say it usually works that way. It usually works that way.
I know, And one time she was running late. And she is notorious. She has to be on time. And she called them and she said, I can't bring the dog because I'm running late from another appointment and I'm coming on my way. They said, no, you go get the dog and you come late. You cannot come here without the dog.
I love it. Dogs, as you know, give unconditional love. They just have a feel good about them. I know when I walk in and I see my Sierra, she sees it. Well, Sierra is with me wherever I go. But when I do have to leave her at home and I walk in, and Ken will tell you, his dog is the same way. They get all dancy, prancy, happy. It's just, it's like a feel good. Feel good.
I know my brother says the only person that's happy to see him when he comes home from work is the dog.
Oh, dear Lord.
I have no comment for that. None.
I wouldn't touch that on a bet.
I know. And then one other quick story. So this was a lady, an 89-year-old woman that we got from a rehab. And she had an ostomy, which is, the bag that collects, from the abdomen.
Right.
Okay, so you know what that is. So they said to her, you have to take care of this when you go home. You'll have home health, but they will discharge you. 89 years old. She said, I will never touch this thing. I didn't want, So she had home care, and I came in because they were ending the home care and we were going to take over. I said to the home care nurse, she has, it's all red around her, the ostomy. What's going? Oh no, that's normal. No, that is not normal. And I said, you need to address this. Well, we're discharging her so you can take over. Well, yes. So that home care discharged her to us. We managed her. We got nursing in there 3 times a week. We managed that infection. She would have died from peritonitis if we had not stepped in.
But that's the difference. You
Yes.
and your organization put your patients first, and you care. And as somebody who loves his mom or dad, that's what they want for their parent. They don't want to just cast them to the side and say they're all yours. You do what you need to do, and
Right.
how that works out for you. Well, God bless you. The caring part is what sets your organization apart from all the others. That you can't put a price on that. You really can't.
Right. And we have 2 bosses, Lenora and Alex, who couldn't be here, who have hearts of gold. And both of them, Alex, for our veterans, gives me $40 per veteran that I can go and say, do you want to go to a movie? Do you want lunch? We've had pizza parties. We've gone to different, I was going to take one veteran to a show about, he was a Vietnam veteran, and guess what was showing?
That's
Top Gun.
Not a great idea to take him. So we ended up, we did a pizza party for him.
Wow.
And Lenora came up with housekeeping. So we do volunteer housekeeping for the veterans that, need a little extra help to straighten up things. Will, come in and, we're not going to do major getting on ladders and dusting and this kind of thing. But
you're not going to clean gutters?
No.
No, but I will say,
you're not going to load my dishwasher?
No, we're not going to do that. But we did do this veteran who had lived in his house 55 years, never took anything out. We came in to help his caregiver kind of straighten and, get things organized. Lenora and Alex go up to the attic to take care of things. And I say, I have allergies, so I can't go up there. So I got
good excuse.
I know, some nice job. And they're up in the attic with masks on and stuff, but that was really something.
Again, it's all about the service and the caring that sets you apart from everybody else.
Yeah.
Now, when you're there for like a full week with this patient, do you give any kind of report to the family? Is it all just verbal? Do you give any kind of written report on progress or stuff that maybe they should be looking out for?
Oh yeah. Well, we have a plan of care that we send them so they know exactly what the caregiver is going to be doing as far as the ADLs, the personal care. And then, and the nurse will then update, the patient or the client on what is going on.
Yeah.
Definitely.
We do provide RN oversight. So that RN is in communication with our clients and their loved ones regarding care, any changes, any issues or concerns regarding the care. But again, we're all in communication. The care team are in oversight just to make sure that they get the best care.
What's the hardest part of making this all work for you?
I think one of the challenges is, there are some people who are not receptive to care, and so there are people who need care but don't want it, so we tried. But again, we've had opportunities where once we've able to build that connection, build that relationship, it's a total 360. And so, I think the challenge is, really, we try to work to overcome any challenges or obstacles we may face, because again, our goal is to provide high quality care. And again, sometimes we get roadblocks, but that's our goal. Okay, how can we overcome? How can we improve their quality of care? What are some things that, we can avoid just to, just avoid any type of distraction? So we try to work with the individual, what they like, what they don't like. And so if it is a challenge in the beginning, we can overcome those challenges.
Do you talk to, before you go in, I'm sure you talk to the family and they give you kind of like a heads up. This is what they're like. This is what they do. This is what they don't like to do. How long does that take? How long does that process take?
We don't have a stop clock, right? We're not, we don't time ourselves. We've had some of those initial meetings would be 45 minutes to an hour. There are some that can take a little bit longer. I know Wendy was in a meeting with a client for maybe 3 hours just because they were able to build that connection and rapport. But again, we do not have a timestamp. But again, it just varies depending on the individual and the client and how much help they need.
But the more you know about the patient from their family,
absolutely,
the better service you could provide that patient.
Absolutely. We do an initial phone consultation just to get an idea of the individual, what their condition is, what their needs are. And when we get into the home, that's our opportunity to put a face to things and do a home assessment and also reevaluate their personal needs, their physical needs. But we do try to get a lot of information early on, so that it's more physical when we come into the home.
If somebody...
I'm sorry, Michael. So it's just so it's just not home. Say you do you go into like assisted living, senior housing?
So we've had clients in assisted living or independent living where they need companionship or need someone to come and help them in that capacity. The biggest thing, I know that there are facilities that have their own staff, so we definitely don't want to, to have a conflict there. But again, we've had clients who have hired us directly who live in those facilities, just provide additional support and care.
Okay. Now, I will tell you, the veterans, we're not allowed to do that when they're in a skilled nursing facility. And I've tried to talk with the social workers to say, the staff there's, a shortage of nurses and caregivers in these facilities. It would help the veteran if you had us, there, and they won't pay for it.
Why do you think that is? It's just the government funding?
No, they're getting care. I said, well, it's limited because they don't have this nursing staff.
Limited would be putting it mildly.
Mildly. You know what? You were just so politically correct. I'm United States Navy. I like the way you put that because my language would have been a lot different.
Right. I know. Yeah, I was just at Hines and this Navy, he was an officer, retired. He gets in the elevator, goes, "This is a bunch of..."
Yeah.
With the language. And then he looked around, he goes, "Oh, excuse me. I didn't realize there were people in the elevator. Sorry about my language, but this is a bunch of..." And then okay.
Well, I'm Army. We're not so tactful.
Okay. I know.
I love it.
Yeah.
Wendy, tell us about this honor flight.
Oh, yeah. Okay. So, this is really my first year. My client went, and he was actually interviewed on channel, I think it was 7, by a reporter that had come, and she was like, "Oh my gosh, what's going on? There's all these orange shirts, there's flags, there's, a band." And so she interviewed, and he told me about it. And I said, "Oh, I would love to do that." He goes, "Yes, you call so-and-so and you volunteer." So they did accept me as a medical volunteer. It's done from April to our last one is next October 15th. That's our last flight, and then they'll start again in April. It's a 2-year waiting list.
Wow.
So yes.
Whoa.
Yeah, 2 years. If you have a medical condition, they'll put you ahead. And if you're a World War II and a Korean War vet, they will put you ahead so that you can get on because of the age and, So you would go to chicagohonorflight.org. And then it's so easy how to apply to, get on the list as a veteran. We pay for everything. They don't pay for one thing. It's the most unbelievable event. The veterans that I've talked to, they say it's changed their life.
I've seen them cry.
Yes, every one
actual
of them.
Tears in their eyes.
Yes,
being finally recognized and somebody really doing something for them that they never thought they'd be able to do on their own.
I know.
So it's such an honorable thing to do.
Oh, it is.
We don't do enough for our veterans.
No, we certainly
really
don't. We don't. And I believe that the veterans should not have to pay for one thing after what, you've all been through. And we thank you for your service. And then, we wouldn't have a country without our veterans, So that's our goal. My goal with, I handle all of the veterans for our agency. We really go above and beyond. I do pinning ceremonies, which we just had one where a veteran, he's a very stoic guy. I saw a tear in his eye. Remember?
Yeah.
Lenora brings these cakes. You've never seen cakes like this in your life. They're just amazing. And then, we really just cherish this population that we're able to service.
We don't do enough for our veterans, but the honor flight is just a gift to our veterans.
It is.
And Lenora, what you're doing, bar none, hands down, I know if I had to put my mom or my dad and have them have care, I'm calling you. Because bar none, hands down, I could just feel, and everything I've heard about your organization, it's truly amazing. It really is. So
thank you.
God bless you for what you're doing for our elderly or not even elderly. I'm sure you have young patients as well.
Yeah.
That have issues, mobility or whatever kind of issues, but God bless you.
Thank you.
You have to be such a compassionate person to do what you're doing.
Absolutely.
You really do. You don't wake up in the morning and say, I'm going to go take care of somebody.
Oh, no.
No,
Yeah.
Yeah, and I will say that all of our staff, have that compassion because we really, really target for that.
And I love the name, BrightStar.
Yes.
I know.
It is a bright star in somebody's life.
Yes.
Yeah.
And again, I can't thank you enough for what you're doing in the healthcare industries, especially how you look over our veterans as well. Giving them extra attention or, just taking care of their needs because they are special people. They really are. And they need that special attention that BrightStar provides. So I'm so happy to be able to get the word out. I know we've been talking about doing this podcast for a while.
Yes.
I'm so happy we're able to get it done because so many people really need to know that there is hope and help out there for their loved one.
Absolutely.
Right.
Because, to me, bar none, hands down, you got it rocking. You do.
Yeah, you're rocking.
Thank
You are
you.
rocking.
One other thing I wanted to say is to get the word out to the veterans about this benefit because they've done a great job with the suicide number, and that is a top priority, of course. But the veterans don't know very much about their benefits, especially the free caregiving that they can receive if they're service connected. So, I go to, and Mike, you're going to join me. I go to VFWs and American Legions to to let the veterans know, if you need help at home with personal care, you can get that if you're service connected, depending on your, the percentage. They decide how many hours, and they can get free caregiving from us.
How much does the VA pay of that bill? Is it 100% like for your services?
Yeah, it's 100%. Yeah, they generally, based on the individual, they do evaluate the veteran to determine how many hours he would qualify for subservice. So so they do have to meet with the social worker, and they have to go through an evaluation to determine how many hours they will be qualified to receive.
So once it's determined that they have a disability or an issue that they need addressed, and they say, hey, I want to call BrightStar and have them come and help me, the VA will tell them, okay, we're going to give you 20 hours a week.
Yes, absolutely. Absolutely.
That's right.
Great.
Yeah, their primary care doctor is the one who puts the referral in, and then the social worker will triage it. Because there are a lot of agencies that are contracted with the VA, but I will say that ours really goes above and beyond for the veterans. And, but it's very important that they know about this benefit,
Now they can find this benefit. Now they can find this benefit on va.gov, right? They'd have to get on, or My Healthy Vet, to find where this benefit is located.
Yeah, good question.
I know where it's located, but I want you to get it.
Okay. All right.
I am 100% disabled veteran, so I know where you're coming from, but I do like you do. I try to get that word out, and hey, look, you got these benefits.
Right.
Sometimes the VA doesn't want to tell you about them, but
if somebody is watching this video, whether it's live tonight or we're going to post it all over, and they're interested in learning more about BrightStar, tell us how they could do that.
Absolutely. Well, we can actually post our contact information, but they can always call our main office, 312-382-8888, and speak with a representative. We also have our website, brightstarcare.com/Chicago. You can always reach us there. So we're happy to help any way we can.
Right. Yeah.
Well, I want to thank both you lovely ladies for giving us so much information that needs to be out there for anyone who has a loved one that they really care about and want to make sure they're getting that personalized attention, as well as our veterans. I mean, that's amazing what you do for our veterans. So God bless both of you.
Yeah. Well,
and just thank you for being my guest tonight and getting this word out.
Yeah.
Thank you for having us.
Yes, and thank you for
thank you.
Your service to our country and for what you do. Okay.
We try.
Yeah.
Good night, ladies.
Good night.
Good night.
Bye.
Thank you. Bye-bye.